You'll remember that last year in Portland, those of you who were with us there, that we had some folks join us from the Pacific Northwest where they were talking about harm reduction responses in Portland and Seattle and how those cities and states were, and the citizens there were addressing, addressing drug-related issues from a place of compassion and harm reduction rather than criminal justice and all of the extraordinary outcomes that they've had there. Well, here we are in Baltimore, and another area that has suffered so tremendously because of the criminalization and stigma that we place on drugs and the people who use them. And so we've brought in some local activists to talk about how they have responded here in Baltimore to these ever-unfolding crises that we know how to fix, but apparently the government can't figure out. So I'm delighted to have with us today 3 Baltimore locals who are active and engaged in the harm reduction community here, who have been working to ensure that people who use drugs in Baltimore can do so as safely as possible, and who are working to protect these communities. We're joined by Rajani, I'm so sorry. Rajani, thank you. William and Harriet, who are going to introduce themselves.
Hi, I am Rajani Goodlevaletti. I use she and her pronouns. I am the community organizer for the Baltimore Harm Reduction Coalition. My focus is on organizing, coordinating the Bridges group, which is the Baltimore's grassroots movement for safer consumption spaces. It's rooted in racial justice and compassionate care, this movement. This Bridges is a compilation of various organizations, community-based organizations in Baltimore, including Bmore POWER, Communities United, ACLU, LEAP, which is Law Enforcement Action Partnership, OSI Baltimore and Drug Policy Alliance. Lots of different organizations and individuals are part of this coalition that I coordinate, but it is very much centered in having leadership from folks who are from communities who are directly targeted by the war on drugs. Baltimore is a largely black city, so we need to recognize that the war on drugs, as we all know, targeted specifically black folks, right, and is rooted in racism. And so when we talk about creating safe spaces like safer drug consumption spaces, we want to make sure that if we are advocating for that in a place like Baltimore that has been so devastated by the racist war on drugs, we also have to acknowledge what racial justice looks like in the harm reduction movement, in these movements. So that's a lot of what we do at Bridges, is we are working to advance understanding of safer consumption spaces and obviously, advocating for legislation. In Maryland, that is a tricky thing. We are not San Francisco or Seattle or even Philadelphia, which is moving forward. We do have a long road to go, but it's really important to recognize how much, there's not too soon to start, right? And even if we know that politically we won't get to the place of having a safer consumption space here in Baltimore or in Maryland tomorrow, even though we needed one yesterday and needed many yesterday, we know that we have to have conversations in communities about what these are. We need to demystify them. We need to have conversations with communities who are really pissed off that now that the face of overdose is more white, there's a compassionate approach, right? And so we try to have those conversations. That is a lot of the work that Bridges does. Our members do outreach across the city. We lead conversations in a variety of locations in communities, which we call these events called Seeking Safety in a War Zone, which are these community dialogues that we organize. We also do a lot of presentations at many of the universities in the Baltimore area. There's a lot of students in Baltimore and a lot of students who really, really care about these issues and want to not only advance safer consumption spaces and advance harm reduction here, but also want to integrate that work and harm reduction philosophy in their education, right? We have one of the premier public health universities here in Baltimore, and I attended that university, which is what brought me to Baltimore, and I can tell you that there is no harm reduction education there. Granted, that was in 2009. I came for my master's in public policy. I'm originally from the San Francisco Bay Area, and I moved, yeah, holla, I think I heard a woo, better be a woo. I'm originally from the San Francisco Bay Area, moved to Baltimore as a student, as a master's candidate, public policy, focusing on criminalized issues. So I don't like to say criminal justice policy, I like to say criminalized issues like drug use and sex work and homelessness. And in that work, I felt that I couldn't just rely on this education that Hopkins was providing me. And so I sought out community-based organizations that I could work with, do an internship with, volunteer, whatever the hell I needed to do to not be in that bubble. I couldn't ignore what was happening in the city, so I ended up working for a brilliant grassroots organization called Power Inside in East Baltimore. It is a center for women in sex work, unstably housed, drop-in center, lots of services. So I did my graduate internship there. And there is where I learned what harm reduction is. And there is where I learned about the ways that racial justice and harm reduction are interconnected, or at least should be. So I was able to bring those lessons from that work, from that internship, into my formal education at Johns Hopkins in my public health and policy classes. And so through that, I made connections. There were many other students who cared about harm reduction. We are still friends 9 years later. We still connect. And we also, and they also all spread into kind of high power positions around the city and state, so that really helped me out. And the professors and other networks I had there. So then over time, since then, I was able to connect with the harm reduction kind of research and work. After I graduated, I got a job in harm reduction research at School of Public Health at Hopkins, and through that, I ended up in this organizer position. And so, I'm like, am I talking too much? Okay, cool. And so, I guess I was part of, I worked as a research assistant, right? I used these networks that I had from when I was a student to say, hey, I wanna get involved in what this looks like and ways that we can connect community and have more accountable research practices. Since Baltimore City also, when we talk about the systems of oppression here, it's not just the criminal justice system, it's also the medical system and the research systems, right? Johns Hopkins, which I have a hard time saying I'm a student of Johns Hopkins when I'm in Baltimore, or that I'm a graduate, because Hopkins also has a history of experimenting on Black people, and murdering Black people, and displacing Black people. And so to say that I'm part of that institution is really challenging, especially when I'm also supposed to be organizing, but I also have to acknowledge that privilege that I've had, and also acknowledge that truth, right? Transparency is important. So a lot of the work I did after earning my master's, inevitably when I went back to work at Hopkins, I did a lot of kind of building up community advisory boards for research studies on harm reduction, specifically focused on sex work, street-based sex work. And through that, I had these connections to people who had the ears of legislators and funders, particularly Dr. Susan Sherman at Hopkins School of Public Health, who is a lead harm reduction researcher in the country. And I worked for her, and she also was doing, while I was working for her on this sex work research, she also was doing a cost-benefit analysis on safer consumption spaces in Baltimore. That got a lot of attention. Inevitably, funders like Drug Policy Alliance and OSI Baltimore decided, hey, we want to fund that. We know that, again, legislatively, this might not work out in Maryland tomorrow, but your research is showing us how important it is, and we have the data. So then Susan was able to get a grant for a community organizer for safer consumption spaces. I ended up getting that job. And then the first thing I said on my first day was, it's great that this exists. It's amazing that we have this funding for community organizer. This does not need to exist at Johns Hopkins. I will not tell folks I work for Johns Hopkins when I'm going out there organizing. So one of the first things we did was try to work on where can we bring this position moving forward. And so that's where I ended up after several months. We moved it over to Baltimore Harm Reduction Coalition, and now I'm a community organizer with Baltimore Harm Reduction Coalition, community-based group that I think Harriet can speak more to. Thank you.
Great.
Good afternoon, everyone. I'm Harriet Smith. I'm also with the Baltimore Harm Reduction Coalition, and I serve as the director. To kind of introduce you to what we do, I'm going to first talk a little bit about myself and my own history with harm reduction, then talk a little bit about my organization, and then kind of talk about the future of both myself, maybe, and the organization. So me, I grew up in Baltimore, just outside Baltimore, in a place called Woodlawn, made famous by the podcast Serial, if anyone has ever heard of it. I went to that library, but anyways, doesn't matter. I grew up in a very chaotic household where, by necessity, we used harm reduction every day. We didn't know to call it that. We didn't know there was a whole movement out there. We didn't know there was a framework and understanding of these practices for severe mental illness. But we certainly used it every day to survive, to get, to my age now and to be here in front of you all. Like Rejni, I was introduced to the term harm reduction when I decided I wanted to learn about street-based sex work and what women were facing who were experiencing homelessness, and I decided to volunteer with Power Inside. Like Rejni introduced, Power Inside is a nonprofit organization that serves women who experience homelessness. It's a human rights-based framework that they use, a harm reduction-based framework that they use. And that's when I formally kind of got grounded and rooted in this thing called harm reduction. Fast forward a number of years, and Baltimore Harm Reduction Coalition was founded in 2011 by students at Johns Hopkins University, a historically white university in Baltimore, a historically black city. And they were interested in filling the gaps in their curriculum, that this is a public health institution, that there are School of Nursing, School of Medicine there, and they were not teaching harm reduction. They were barely learning about any kind of social justice intersections with what they did every day. And they certainly weren't learning about the history of their own institution. So they sought to rectify that with a student group, and then it grew and grew and became its own group with its own funding, not tied to any university anymore, but certainly has its roots in student activism. And now we're looking to the future and really wondering, like, what can we add to the conversation? There's a number of harm reduction organizations in Baltimore City now, but most are tied to the government in some kind of way, either quasi-governmental or straight up Baltimore City Health Department, right, under the purview of the mayor. Can't say everything they want to say, but I can say everything I want to say because we're not tied to any kind of governmental institution. So with that, I'd like to say that we're moving forward with a framework of racial justice. That is our future, that's the future of the organization, and that when we advocate for policies, we have to look at the racial justice implications and use an anti-racist framework to advocate for policies at the local and state level, and even internal policies of just like how we want to function with each other. With that, reparations are critical and a useful foundation for understanding how racially just policies can be created. I won't talk too much about that unless there's interest in, we can like have a dialogue. I'm sure both of the other panelists would love to chime in as well. But there's a lot of work being done here in Maryland, or some work being done here in Maryland around marijuana policy that says, legalization might be the future, but it's not an appropriate future unless it takes into account the past. And taking that into account means reparations for the Black and brown people who are incarcerated, means reparations for the Black and brown people who've been killed and displaced.
My name is William Miller Jr., and I work with the local health authority in Baltimore City. Also, Bmore POWER, which is Peers Offering Wellness Education and Resources. I'm the coordinator. And just a little brief history about myself. Last night, some guys had a very interesting night on being showed around Baltimore, and I called it the Wire Tour. And I took these gentlemen around along with my daughter, because it's a generational thing with me. My father and mother both used. I grew up in a low-income housing in West Baltimore. It's high-rise, called Murphy Home. They tore them down. I know all my apartments I lived in. So it was for me, growing up, taking care of my 3 siblings as a young age, and then getting incarcerated. I've done 14 years from 2008. From 1994 to 2008. And coming home was something that I planned for it, something that I planned for. I planned on and I structured what I was going to do. It didn't go as well as I wanted it to, but it went, and I stayed with it, and I've gained a lot of my knowledge from being incarcerated. I was able to deal with people from being incarcerated, and some of the institutions I was in, it was just like cattle. It's like one way, you go that way. So I came home and was doing great working, and I'm moving fast forward to how I got to doing harm reduction, because I've been doing it a long time, but I didn't know I was actually doing it. So June 15th, Father's Day, no, June 21st, Father's Day, I was struck by a tow truck, hit me, and it was like, well, what can I do now? So I'm like an athlete that left school early, tore my ACL, I need to use my brain. And I went through some Harm Reduction Coalition trainings and started actually figuring out what can I do? Because I just was a street guy, wanted to go outside and do street outreach, and it's more to that. So now what we do, we go around Baltimore City, we do a lot of naloxone trainings. And this is a community engagement thing, because when you start having those community engagements and you're talking to people, it's not just giving them naloxone and tell them on their way. We listen, we provide links and resources, and we all collaboratively work together. That's where it starts at too. We all collaboratively work together. We all have our own little sector that we do, but we work together. And some of our things are what we do is just go out and let individuals who use drugs know that they are someone. The language that is being used is one of the biggest keys. And the media portrays a picture that is so false, in Baltimore City. And the picture was portrayed about MAT, about how where all the violence in Baltimore City is coming from around methadone clinics, because they was unaware of the reaction of a mixture with methadone and different substance. And that's what they showed on the news. And that's how it looked. This how methadone looks. That is not how methadone looks. And so we had to advocate and do that. We actually tried to get a meeting with her. Unsuccessful of doing that. We was unsuccessful, but we still, making sure that we educate. And we use that term, meet people where they are. We're not just talking about drug users. We got to meet the drug dealers where they are. We got to meet the politicians where they are. We got to meet everyone where they are. Because some people just think they need to relate. I always like to use that. Some people think they need to relate. All you have to do is understand. It's not about relating all the time. If you understand that what's going on, and you understand that it's just not right, that people are dying while we sitting in this room right now, and that's a fact in Baltimore City. People are dying right now while we sitting in this room. If you understand, then you can be a help to this problem. You can advocate for people who use drugs or people have been affected by it. And my number one thing, and why we was with Bridges, Bridges came about, it was about 2.5 years ago. It was a little conference in Baltimore City. And we need to get it organized like Reggie, which is great. I was feared of not my child seeing someone overdose, but the effect that walking into a public restroom and seeing the actual event happening. How much traumatizing that would be. So that's my whole, like, the push, the passion that I have, because it affected me. It affected me. No problem. Yeah, it affected me, and it could have been more detrimental to me. But that's why I give my story. I let people know what I went through, and I do it for the youth. And collectively, the information that we have, and some people might hear me said this before, but I might sound like a broken record, but the information we have, we need to transfer that information to each other. I can teach you a little bit about what you know to understand why this happened, the racial injustice, homelessness. And I need to know about, okay, how does this work in the policy piece? Where we need to go at first? What's more effective? Because we all collectively have to work together. And we know how and why I started in Baltimore City about, this being a public health issue. We don't have to keep talking about it. But we need the people know to be aware of it. Know this. Because we still losing people. We still losing people. As we speak, we still losing people.
Can one of you speak to the scope of this crisis here in Baltimore? Like, what is, you say that we're still losing people. What is that, what are the numbers to help us understand broadly? Just to give us a sense of what that really means.
Sure. Okay. Overdose Baltimore has always had high overdose rates, and in particularly the highest in the state of Maryland, and has been known, right? So you have the actual numbers of the overdose rates, the usage rates, and then you have just sort of the rhetoric, which I think is also important to talk about when we're talking about numbers. So what I mean by rhetoric is often there's, as Will was talking about, Baltimore is the heroin capital of the country, of the world. It is the most dangerous city in the country, in the world, right? You have The Wire, which was actually explored a lot of different aspects. But when you have that sort of media sensationalization, that stigma of this city, that also impacts the ways we even hear or see these numbers. So I just want to put that out there. Now, knowing that, overdose rates in this city have increased, I believe it's 3 times as many numbers each year, essentially, over the past few years. I'm blanking because of Sunday afternoon on the exact numbers, but you can Google it. But I think what's important to know is that it's close to 680-ish. I believe it's 684 overdose deaths in 2016, We don't have all of the numbers yet, and that's in Baltimore City, right? So 684 in Baltimore City alone. In the state of Maryland, it's over 1,000. That's throughout the whole year of 2016. We don't have exact numbers yet for 2017, but I will say throughout the course of the first 9 months of 2017, it is clearly 3 times more than the previous year. In addition, the fentanyl, as well as carfentanil, have been found. Well, let me start with fentanyl. Fentanyl, in 2012, of all the overdoses in the state, in Baltimore City, there were 12 overdose deaths that had of people who had fentanyl in their system. 12 in Baltimore City in 2012. I believe 70% in 2016 had fentanyl. Somebody do the math in here on that. But that's a dramatic increase over those years, right? It went from 12 to 75 to 300 something to 500 something to 600 something. And then it became the vast majority of people who have died from an overdose in this state have fentanyl in their system. Often it is a case of having where they used almost 100% fentanyl. We also have carfentanil, which is another analog. So fentanyl is 10 times stronger than morphine. Carfentanil is even stronger. Is that right? 100 times. 100 times stronger than morphine. My bad. Carfentanil is even stronger. When somebody has fentanyl in their system, and they experience an overdose, you have to use naloxone. Often there are 2 or 3 times you have to use naloxone to help that person actually maintain being revived, right? Carfentanil is even stronger. I'll say another thing is that I had the privilege of being able to go to Vancouver last April to visit Insight, the safe injection facility there. When I was there, it was dope. And when I was there, they had told me about carfentanil. I hadn't heard of it before. And it was such a rampant issue in Vancouver for at least over a year. And I said, I hadn't heard about it. We really need to, talk about that in Baltimore and be aware that it could come. 2 days after I landed in Baltimore, we learned that 3 people had died with carfentanil in their system. So it's just that fast. At that point, when I was in Vancouver, nobody had even really experienced, or that wasn't found in many systems in the United States. So it really moves quickly. So those are those numbers. I hope that's helpful for that
great.
kind of,
yeah. Thank you. We're going to move into what we have to be hopeful for and what we can work for in just a moment. But I want to take a moment to return to something that you said, William, which is that we don't need to relate, we need to understand. We are a room full of people who have, at the very least, though we might not share many other privileges, we are a room full of people who have had the privilege of attending college. And that is a privilege that many people in the communities in which you lived here are divorced from by generations of racist economic and other policies. Of course, the primary tool of which now is the war on drugs. And I want to know, can you give us some advice about how we show up for your communities in a way that is respectful and helpful and useful, as opposed to providing flawed answers from our positions of privilege?
Just be as transparent as you can. If you don't know, you just don't know. That's something we always say. And I won't call it giving advice. It's just what I do when I go to someone's neighborhood. So we all know about NIMBY, Not in My Backyard? That's something that usually happens. And people just go and set things up without even doing any community engagement. So if I was asked of what I need, how can you help me like you just did?
Yeah.
That's the simplest way right there. How can I assist you? How can I support you? And what do we need? And if you can't give it, just simply say you can't. Because most people, if you say you don't give me something, I'm pretty sure they would want that. So if you can't, guarantee that, don't even bring it up or anything. Just make sure that you ask the individuals what it is that you need. Because when I say dealing with people where they are, and I deal with a lot of people that's on the street that's indigent at some point where though they ask for certain things and you offer them something else. We got to try to get them what they ask for.
Thank you very much for that. You all are working in a really inspiring coalition of organizations and groups that are, and government actors even, who are trying to move this conversation forward, trying to implement more harm reduction responses, trying to bring safe consumption to Baltimore, even though it's a long road. Can you each share with us a bit about, again, what are you hopeful about? What does this road look like? And how are we going to, the big community we, how are we going to how are you going to get safe consumption facilities open in Baltimore? How's that gonna happen? A little bit of like the mechanics of it.
What I'm hopeful for is just actually safe consumption. So we actually had a bill that got pushed through and then snatched off. And at one of our meetings, when we found out that it wasn't going to be moving forward, I simply said, that's a plus for us. We did it. Somebody accepted that. I mean, it was like, it's a plus. Now let's plan for the future. So we making those small steps, which a year ago there wasn't no steps at all. And we didn't even know that we was gonna actually like be able to actually move on this bill. But just being collaborative, and we all and a lot of Bridges Coalition network, we found out what's going on in different cities, what's working and what's not working, how it works. And one guy told us, and I always said that because he's working in the White House, Michael Botticelli, said he was working in the White House. He's working in the White House, and things he couldn't say out loud, you know. And it was like, he said he made a lot of mistakes about things, and I was like, what can we do not to make those same mistakes? And he simply said, don't be afraid. Don't be afraid. So I stepped back a little bit off of some of the things that I was doing with Bridges, but as in like, because we doing little small committees and things now. Now my job is to make sure people on the committee get there, and I've been doing an all right job of doing that. And we have an event coming up Tuesday, which I was out doing outreach earlier just to pass the flyers out about this same conversation. But like moving forward, being collaborative, and making sure we know what's worked. Who do we have to talk to influence this person to get what we need to get done, and how do we do it? And we have to realize everybody have a part in it. What is our part? We all have roles. What is our role? Because I can go talk to someone that Harriet can't talk to. Harriet go talk to one that I can't go talk to. So we need to know this. And we, like Reggie do a hell of a job. She do a hell of a job. And we talk to the people that we need to talk to get it done. And most of the time, they bring people who use drugs. People who use drugs is in these rooms at these tables.
So I want to say it's as simple as convincing white people that black people matter, but that's not simple, right? I feel like that is some of my role in this as a white person, is talking to my fellow white people and convincing them that Black lives matter. When I saw the phrase that the war on drugs is a war on us, I find that that is accurate, but it is also, it might blur the specificity that is needed at times. And I think that it's that specificity, it's that underlying truth that I'm in a position to be able to tell for a number of reasons, including my whiteness. And it's something that is I find that, like, when I say this, a lot of people are like, oh, that's kind of a pessimistic view and not a hopeful off into the future view. But for me, it feels like a hopeful off into the future view because it's rooted in truth. I am like a believer in that when we speak the truth and speak the truth to power and don't back down from that truth, that change may come, and that, for me, that is a hopeful position. That's all.
I don't think that's all. I don't know if I can say much more than what my colleagues have said. I will say that I feel in the past few years in Baltimore, so much like Will and Harriet have said, I have a similar experience in which I feel like I was doing harm reduction before I knew what it was, right? My family is Asian Indian, immigrated here from India. I was first born in the United States. We dealt with eviction. We dealt with the false American dream. We dealt with, the broken mental health system, right? And those are systems that I, growing up, and wasn't sure how to navigate, right? And so we just kind of did what we could do and reached out to the family and communities and people that we had. And it also created a lot of mistrust, right? So I, as just an individual, person of color, queer woman of color in this world, have a hard time sometimes building trust with folks, right? I'm like, I don't know if you are gonna throw me under the bus. And specifically with white folks and specifically with men, right? People who might have certain relative privilege to me. So I say all that because I feel as if what I love about the Bridges Coalition and what I love about the work we do here in Baltimore is people really underestimate us here in this city, right? And they're like, you're so new to harm reduction, that's so cute. And I'm like, nah, y'all, we've been doing this. We actually created this. Black and brown people created this thing. And when we have this coalition that is quite multiracial, it is quite a multiracial organization, but it's also a coalition that has people of a variety of professional experiences. I failed to name that Nurses for Justice Baltimore is also a big member of our coalition, and those are people who are actively public health nurses who are interested in doing like street-based sort of outreach and nursing care, right? So we have people who have this medical experience and expertise and policy and all these things, but everyone who comes into that room, I'm hoping, comes into a room for Bridges Coalition knows that we are centering the voices of people who have been targeted by the war on drugs, people who are currently or say that they, people who are in recovery, say that they're in recovery or say that they're using, right? We are centering those voices and not just, hey, give us a good story so we can tell legislators, which does help, but also what strategies do you think are helpful? And so when we have Bridges meetings, even though it's wild and people are saying all sorts of stuff and I have to facilitate all that, I love those meetings because it reminds me of like this mess of beautiful rainbow people all know that we are centering racial justice and we give a shit and that we are hopeful. And when the politicians decided to backtrack on some support that they said they had for our SCS bill and then did some backroom dealings and took that support away, right? We were really excited. We thought we moved this forward and then they took that support away. And that is something that could really devastate a movement, right? To feel like, dang, we can't even trust when they tell us that they're doing something. We can't even trust that. We already don't trust institutions. We already don't trust systems. How do we move forward if we can't even believe what the words that they say, right? But this coalition, this like beautiful coalition that we have is still so optimistic and says, no, we got this. We're gonna make it happen. And I think even though I'm a very skeptical, pessimistic person, the folks here sitting up here with me and all these other people we work with really keep us going. And I think that makes me hopeful about our work and our movement. And so just as far as strategy, I'll just say again, it's about reducing stigma. This is a stigma issue. We know the numbers about safer consumption. We know the numbers about naloxone. We know that criminal justice doesn't matter. We have police, active police, constantly saying that we can't arrest our way out of the situation. And then they still make these decisions. And the only reasons that they do that I can come up with is racism and stigma, right? That's it. Because we have the numbers and we have the evidence. So So that's where our strategies are around how do we acknowledge this racist history, be transparent about it, how do we demystify issues so that we can reduce stigma and really find each other on a human level and humanize these issues. Because people are dying every day, and this is just ridiculous. We need to do something now.
We need to do something now. We're all here in this room together because we know that. So is there something that we can do from our cities across not just the United States but the world? Is there something that we can do now for you and your community?
Tell the truth.
Yes.
Educate.
Now I'm gonna be really verbose because y'all had one words. I have many words. Okay. Number one, if you are a resident of Baltimore City or the state of Maryland, please come talk to us or sign up for our listservs or whatever so that you can get information. We, at the Baltimore Harm Reduction Coalition, we are doing letter writing, postcard signing, all of these things to let legislators in Annapolis know that they're fucked up and that, that we care. And when I'll just say, because I kind of alluded to this and to be more clear, our state Senate, a committee, had originally voted in favor of an SES bill. Then over the president's weekend, they took that back with threats from Republicans who said, it's an election year. So they went to those committee members and they said, you're up for election this year. I saw that you voted in support of SES. If you don't change your vote, I'm gonna make your election hell. I'm gonna make a mess out of it. So then they're like, oh no, we need a revote. We weren't all totally informed. Had a revote, voted it out unfavorably on the bill. They took it back because of their political, weak-willed minds. So if you're as enraged as I am, and if you are a resident of Maryland or Baltimore, come and do something about it. So write a letter, write a postcard. You can go to the Baltimore Harm Reduction Coalition website and find a letter template. So that's one thing. Otherwise, yes, be very honest and also do your own education on yourself and your role, right? What is my level of privilege in this? Yes, we are all impacted by the war on drugs. It is a war on all of us. And what does solidarity and resistance look like? And how do I support folks who have been generationally targeted by it? And so really do your personal work and be very honest and transparent, exactly like my colleague said. Thank you.
You all are doing such incredibly important work, and I'm so grateful that you came and gave us your time to participate in this conference, to educate us about what's happening in your city. This beautiful, amazing, dynamic city that is so much more than what people say it is. Thank you so very much for joining us and for all of the work that you do to keep Baltimoreans safe. Thanks.